What I'm about to share may completely change the way you think about blood pressure after 50. Because what if the real reason your numbers stay high has nothing to do with needing stronger medication and everything to do with how your body responds to food at each meal? With just a few simple changes, you can start. Today, many women see their blood pressure shift within hours, not weeks, starting with the very next bite. I'm Dr. Eliza Hart, a women's health doctor with over 15 years of experience supporting women through the hormonal and cardiovascular changes that begin after midlife. What many women don't realize is that after menopause, the body no longer responds to food salt and blood sugar the same way it once did, and this silent shift can make blood pressure harder to control, even when you feel like you're doing everything right. In this video, I'll share 5 simple food-based strategies that help guide your body into calmer, more stable blood pressure responses, not over weeks or months, but starting with the meals you eat today. Before we begin, please subscribe to the channel. Leave a comment with the name of the country you're watching from, so I can see how far this message is reaching around the world, and help me reach my first 50,000 subscribers, so I have the motivation to keep growing this channel for you. And be sure to watch until the very end, because I have a small but important surprise related to this topic that most women never hear, and it may change how you approach your next meal, starting right now. 1. Eat vegetables first to prevent blood pressure spikes. Many women are surprised to learn that blood pressure does not rise simply because of what is on the plate, but because of how the body reacts in the first moments after a meal. After 50, the metabolic system becomes less forgiving, and even modest changes in blood sugar can trigger a chain reaction that affects blood vessels within minutes. When glucose enters the bloodstream too quickly, insulin rises sharply, blood vessels tighten, and blood pressure follows, which is why post-meal spikes are so common and yet so rarely discussed. This is where the order of eating becomes medically meaningful. When vegetables are eaten first before protein or carbohydrates, they create a natural slowing mechanism inside the digestive system. Vegetables are rich in fiber and water, and when they reach the stomach first, they form a physical barrier that delays how quickly glucose from the rest of the meal is absorbed. Instead of overwhelming the bloodstream, nutrients arrive in a calmer, more controlled way, allowing the cardiovascular system to remain stable rather than reactive. This response is not theoretical. In 2015, a clinical study published in Diabetes Care examined adults who consumed identical meals, differing only in the order in which foods were eaten. When vegetables were eaten, first followed by protein and carbohydrates, last participants experienced significantly lower post-meal blood sugar and insulin levels, along with measurable reductions in post-meal blood pressure. A follow-up study published in BMJ Open Diabetes Research and Care in 2016 confirmed that food order alone could influence vascular responses independent of calorie intake or food quality. This effect becomes especially important after menopause, when estrogen no longer provides the same protective support for blood vessel flexibility. At this stage of life, stable glucose handling becomes one of the body's primary tools for maintaining healthy circulation. Eating vegetables first helps reduce insulin-driven sodium retention, supports nitric oxide release, and encourages blood vessels to remain relaxed rather than constricted during digestion. What makes this strategy so powerful is its simplicity. Nothing needs to be removed from the diet, and nothing unfamiliar needs to be added. Completing vegetables, first allowing the body a brief moment to respond, and then continuing the meal gives the digestive and vascular systems time to adjust. Over time, many women notice that blood pressure readings taken after meals feel less volatile and more predictable. This approach also helps explain why some women see different blood pressure numbers depending on when they measure. When meals are processed more gently, the cardiovascular system is not forced into repeated cycles of tightening and compensation. Over time, this steadier internal rhythm can support more consistent readings across the day, rather than sharp rises that quietly strain blood vessels without obvious symptoms, preparing the body for the next layer of support that builds on this same principle of metabolic calm. 2. Apple cider vinegar to support metabolic blood pressure control. For many women, after 50, blood pressure does not stay elevated all day long, but rises quietly after meals and then settles again, creating a pattern that is easy to miss if measurements are taken only in the morning. This post-meal instability is closely tied to how the body handles glucose and insulin, and after menopause, that system becomes far more sensitive to even ordinary meals. When insulin rises too quickly, the kidneys retain more sodium, blood vessels become less responsive, and blood pressure drifts upward in ways that often feel unpredictable and frustrating. Apple cider vinegar works at this exact metabolic intersection. When consumed with meals, it introduces acetic acid into the digestive process, which gently slows how quickly the stomach empties its contents into the intestines. This slower release means glucose enters the bloodstream more gradually, reducing the sharp insulin response that often drives blood pressure spikes after eating. Instead of pushing the cardiovascular system into a constant state of correction, the body is allowed to remain balanced and adaptive. This effect has been observed repeatedly in clinical research. In 2009, a study published in the European Journal of Clinical Nutrition showed that vinegar consumed with meals improved insulin sensitivity and reduced post-meal glucose levels in adults with insulin resistance. Later studies, including a 2016 review in the Journal of Evidence-Based Integrative Medicine, linked regular vinegar intake to modest but consistent reductions in systolic blood pressure, particularly in populations experiencing metabolic stress. These findings reflect what clinicians often see in practice when insulin signaling becomes calmer. Blood pressure regulation tends to improve alongside it. There is also a direct vascular component to this response. Acetic acid has been shown to support nitric oxide activity within blood vessel walls, encouraging arteries to relax rather than constrict after meals. Vinegar also influences metabolic enzymes involved in inflammatory signaling, helping protect the endothelium, the delicate inner lining of blood vessels that plays a central role in blood pressure control. For women after menopause, when endothelial function naturally declines, this added support becomes especially meaningful. What makes this strategy practical is that it does not require large amounts or complicated routines. 1 to 2 tablespoons of apple cider vinegar diluted in water or incorporated into food and taken with meals is sufficient to guide this metabolic response. Over time, many women notice that blood pressure readings taken after eating feel steadier with fewer sudden jumps that once seemed difficult to explain. This is also why some women find that even small dietary adjustments begin to influence their readings within days, because calmer insulin signaling reduces vascular strain before structural changes ever occur. By calming the metabolic signals that follow a meal, apple cider vinegar helps the cardiovascular system remain responsive rather than reactive. This internal steadiness becomes increasingly important as the day moves toward evening, because blood pressure rhythms continue through the night, leading naturally into the next strategy that focuses on protecting your blood vessels while you sleep. 3. Walnuts before bed to control dangerous nighttime blood pressure. Many women carefully monitor their blood pressure during the day and feel reassured when the numbers look acceptable, yet still wake up feeling heavy, foggy, or unusually tired in the morning. What often goes unnoticed is that blood pressure does not simply rest when you fall asleep. In fact, for a large number of adults over 50, it quietly rises at night, placing continuous strain on blood vessels for hours without any warning signs. This pattern, known as nighttime or nocturnal hypertension, is one of the strongest predictors of stroke and cardiovascular events, and it is rarely detected with routine daytime measurements. This is where walnuts used at the right time become clinically meaningful. Consuming a small portion of walnuts before bed provides the body with nutrients that are absorbed and utilized during sleep when vascular repair and regulation should naturally occur. Walnuts are rich in alpha-linolenic acid, a plant-based omega-3 fatty acid that has been shown to improve endothelial function and reduce vascular inflammation. They also contain L-arginine, an amino acid the body converts into nitric oxide, which helps blood vessels relax and maintain healthy nighttime circulation, rather than remaining constricted. Research supports this timing-based effect. A 2016 study published in the Journal of the American Heart Association found that regular walnut consumption improved blood vessel function and led to measurable reductions in blood pressure, particularly when included consistently in the daily routine. Additional studies in subsequent years observed that diets enriched with walnuts improved arterial flexibility and reduced inflammatory markers linked to hypertension, especially during overnight resting phases, when vascular repair should be most active. While many foods support heart health in general, walnuts stand out because they deliver multiple vascular benefits simultaneously, including magnesium for vessel relaxation and small amounts of melatonin that help align blood pressure with the body's natural circadian rhythm. For women after menopause, this matters deeply. As hormonal protection declines, blood vessels become more sensitive to stress and less able to self-regulate overnight. A modest serving of walnuts, about 1 ounce, consumed roughly 30 minutes before sleep, supports the body during the very hours when silent damage is most likely to occur. Over time, this can help smooth out nighttime spikes and contribute to more stable morning readings, even when daytime numbers already appear controlled. If this idea resonates with you, take a moment to reflect on your own experience. Comment 1 if you often wake up feeling unrefreshed or suspect your blood pressure may be changing overnight. Or comment 0 if your mornings usually feel calm and steady. Your response helps others realize they are not alone in what they are experiencing. As we continue, it becomes clear that nighttime support is only one piece of the puzzle, because what you drink consistently throughout the day can also shape how your blood vessels behave over time, which leads naturally into the next strategy. 4. Hibiscus tea as daily vascular support after menopause. As women move beyond menopause, blood pressure often becomes less predictable, not because the heart suddenly weakens, but because blood vessels gradually lose some of their natural ability to relax and respond. Over time, low-grade inflammation inside the vessel walls combined with reduced nitric oxide production makes arteries stiffer and more reactive to everyday triggers such as stress, salt intake, or even mild dehydration. This is why many women notice that their blood pressure feels harder to stabilize, despite consistent routines and careful medication use. Hibiscus tea supports blood pressure through a mechanism that directly targets this vascular stiffness. Unlike beverages that act indirectly, hibiscus contains a unique combination of anthocyanins and polyphenols that influence how blood vessels constrict and relax. These compounds have been shown to inhibit the angiotensin-converting enzyme, the same biological pathway targeted by common blood pressure medications, allowing blood vessels to remain more open and flexible throughout the day. At the same time, hibiscus supports nitric oxide availability, which further encourages smoother blood flow rather than resistance. This effect has been well documented in medical literature. In 2010, a randomized controlled trial published in the Journal of Nutrition found that adults with mild to moderate hypertension who consumed 3 cups of hibiscus tea daily experienced significant reductions in systolic blood pressure within 6 weeks. Follow-up studies between 2013 and 2018 confirmed similar results, showing average reductions of 7 to 13 millimeters of mercury, with some participants responding even more strongly. Importantly, these benefits were observed without electrolyte imbalance, as hibiscus provides a mild diuretic effect without depleting potassium or placing extra strain on the kidneys. For women after menopause, this gentle but consistent support is especially valuable. As estrogen declines, the endothelium becomes more vulnerable to oxidative stress, and daily habits that reduce inflammatory signaling can help restore balance at the vascular level. Drinking hibiscus tea regularly helps calm the inner lining of blood vessels, improves arterial elasticity, and supports healthier pressure patterns, not just at a single reading, but across the entire day, especially during periods of emotional stress-disrupted sleep or hormonal fluctuation. What makes hibiscus tea practical is its simplicity and accessibility. It does not require special preparation or strict timing, but consistency matters. Consuming it morning, afternoon, and evening allows its vascular benefits to accumulate gradually, reinforcing stability rather than forcing sudden change. Over time, many women notice that their readings become easier to manage, with fewer unexpected elevations that once seemed resistant to lifestyle efforts and dietary discipline. As blood vessels become calmer and more responsive, it also becomes easier to identify what may be quietly working against progress. This brings us naturally to the next strategy, which focuses not on what to add to your routine, but on a common dietary choice that may be undermining blood pressure control without you realizing it. 5. The vegetable oil mistake that keeps blood pressure high. Many women are surprised to learn that blood pressure can remain stubbornly elevated. Even when salt intake is low, vegetables are plentiful and daily habits feel generally healthy. In these cases, the problem is often not what is missing from the diet, but what has quietly become a daily staple without much attention. Certain cooking oils, long promoted as heart-healthy, can gradually create an internal environment that makes blood vessels less flexible and more prone to chronic tension, especially after menopause. After 50, the balance between inflammatory and anti-inflammatory signals in the body becomes more delicate. Vegetable oils such as soybean, corn, canola, and sunflower oil are very high in omega-6 fatty acids. While omega-6 fats are not harmful in small amounts, excessive intake shifts the body toward a pro-inflammatory state. This low-grade inflammation directly affects the endothelium, the inner lining of blood vessels responsible for regulating dilation and constriction. When the endothelium is irritated or inflamed, nitric oxide production declines, arteries stiffen, and blood pressure becomes harder to control. This mechanism is not theoretical. In 2014, research published in the American Journal of Clinical Nutrition showed that diets excessively high in omega-6 fatty acids were associated with increased markers of vascular inflammation and reduced endothelial responsiveness. Later analyses, including a 2017 review in Open Heart, questioned the long-standing assumption that replacing traditional fats with vegetable oils consistently improves cardiovascular outcomes, particularly in older adults. These findings suggest that oil choice can meaningfully influence blood pressure regulation through inflammatory pathways rather than cholesterol alone. For women after menopause, this matters even more. Estrogen once helped counterbalance inflammatory signaling and supported vascular elasticity, but as those levels decline, dietary factors play a much stronger role in determining vessel health. Repeated exposure to oils that promote inflammation can quietly reinforce blood pressure elevation even when other lifestyle choices are well managed. The solution is not to fear fat, but to choose it more wisely. Replacing vegetable oils with extra virgin olive oil for low-heat cooking and salads, and using avocado oil or butter for higher heat preparation shifts the fatty acid profile toward one that supports endothelial health. These fats are more stable, less inflammatory, and better aligned with the body's needs later in life. Over time, many women notice that blood pressure readings begin to respond more predictably once this hidden dietary stressor is removed. This change does not happen overnight, but as inflammation inside the vessel walls gradually decreases, arteries regain some of their natural flexibility. When combined with the earlier strategies that calm metabolic and nighttime pressure spikes, removing problematic oils helps create an internal environment where blood pressure is no longer constantly being pushed upward from multiple directions. At this point, the question becomes how to bring all of these strategies together in a way that feels manageable and sustainable, which leads naturally into the final step of putting this approach into practice gently and safely. 6. How to start these strategies gently and safely. After hearing several powerful strategies in a row, it is natural to feel motivated but also slightly overwhelmed, especially if you have been managing blood pressure for many years. The goal here is not to change everything at once or to approach your health with pressure or perfection, but to give your body the opportunity to respond calmly and progressively. Blood pressure regulation improves best when the nervous system metabolism and blood vessels are supported consistently rather than forced abruptly. The most effective way to begin is to focus on sequence rather than quantity. Start by changing the order of your meals, eating vegetables first, then protein, and leaving starches for last. This single adjustment sets the foundation by stabilizing blood sugar and insulin responses, which influence nearly every other strategy you have learned. Many women find that within days, post-meal readings already feel less erratic, which builds confidence to continue. Once this feels natural, the next step is to introduce apple cider vinegar with meals. Begin with 1 tablespoon diluted in water or mixed into food, allowing your digestive system to adjust gradually. This supports metabolic calm without adding complexity. As insulin signaling becomes steadier, blood vessels are less likely to constrict in response to meals, reinforcing the benefits of improved food order. From there, adding walnuts before bed supports the body during its most vulnerable hours. Nighttime blood pressure often goes unnoticed, yet it plays a major role in long-term vascular damage. A small, consistent habit before sleep helps protect blood vessels while the body is repairing itself, complementing the metabolic work done earlier in the day. Hibiscus tea can then be layered in as a daily routine rather than a treatment. 1 cup at a time, spread throughout the day, allows its vascular benefits to accumulate gently. Consistency matters more than intensity, and many women prefer to make this a calming ritual rather than a strict rule that adds stress. Finally, reassessing cooking oils completes the picture. Removing a source of chronic inflammation allows all the other strategies to work more effectively. This is often when women notice that their blood pressure readings begin to feel more predictable instead of resistant, particularly when measurements are taken at the same times each day. It can also be helpful to think in terms of weeks rather than days, allowing patterns to emerge instead of reacting to individual numbers. Keeping simple notes about meals, timing, and readings often reveals steady improvement that might otherwise go unnoticed. What matters most is listening to your body as these changes take effect. When these strategies are combined thoughtfully, they stop feeling like separate tasks and begin to work together as a cohesive approach, preparing the body for the final message about reclaiming long-term control and confidence in the conclusion. As we bring everything together, the most important message to remember is that blood pressure after 50 is not a personal failure, nor is it something that must inevitably worsen with age. It reflects an ongoing conversation between your blood vessels, metabolism, hormones, and the daily signals you give your body. Today, you've seen how simple, intentional changes can gently guide that conversation in a calmer direction. Eating vegetables first helps prevent sudden pressure spikes. Apple cider vinegar supports metabolic balance after meals. Walnuts protect your blood vessels during sleep. Hibiscus tea improves vascular flexibility, and removing inflammatory oils allows these strategies to work together rather than against hidden resistance. My advice is to start simply and stay patient. Choose one strategy and apply it consistently for a week, then add the next when it feels natural. Blood pressure responds best to steadiness, not urgency, and real progress shows up in patterns, not single readings. If this video has been helpful and you feel supported by the information shared here, and if you're able, you may consider making a small donation to help support the growth of this channel. Your support allows me to continue creating thoughtful, research-based content for women navigating health after 50. Before you go, please like this video, share it with someone who may need it, and subscribe to the channel so we can continue this journey together. Thank you for your time, your trust, and for being part of this community.